Hello, friends. A very good day to all of you out there, and a very, very warm welcome from the entire team of RFA tutors, your mentor Desai. Thank you so much for joining in, and a warm, warm welcome from the entire team of RFA tutors. How's everybody doing out there? Hello, Safa. Hi, Orva. Warm, warm welcome from the entire team. I hope everybody's doing great. I can see lots of faces here and lots of people still joining. Warm welcome to the introduction of the June 2026 batch. We are super delighted to start the batch. Forget the mistake and remember the lesson. Every single day, we are going to get better with all those old champions, your seniors. We are going to make it a success in June 2026. Thank you very much for joining in. Safa, is my voice clear? Can you guys hear me?
Hello, ma'am. Yeah, your
Hello.
voice is clear. Hello, dear friends. Welcome you all for the MRCOG preparation.
What are we going to do
Thank
today?
you.
We are going to have the discussion on the reason why you're taking MRCOG1, what it helps you in starting up your career, how to prepare for that. Generally, there's a very high passing in this exam, but if at all somebody fails, what is the reason? What are the preparation techniques? Why at first place we are taking MRCOG? Because it is membership of Royal College of Obs and Gynae UK, prestigious degree, of course, higher credibility, leadership in medical education, competency level increases. You start feeling confident at your workplaces, and of course, it's a globally recognized qualification. Now, there are certain prerequisites for part one preparation. I want you guys to know about this, and those prerequisites have to be fulfilled so that we in the right direction keep on studying hard for this. Safa, please take over.
Hello, dear friends. So, for the prerequisite for the exam preparation, first and foremost would be you have to make an account in the RCOG website. Okay, you when you make an account, you will get a one number, that is the RCOG membership number. Then you have to fill up the eligibility criteria. Previously, it used to be in the form PDF. Now you have to upload all the documents in the website itself. Okay. So the what are the documents required? It is your primary degree, your basic medical degree, either it's an MBBS or ABA, like that. The registration certificates. Okay. Along with that, you may require to give a id proof, which one you are going to show for the whole of your COG journey. Okay, make sure that there is no discrepancy in the name in the ID proof and your certificates. Okay, you just upload this documents in the website itself, and it will take at least 4 to 6 weeks. After that, you will get your eligibility approval. Okay, so before applying for the booking the exam, this is mandatory that you have to get the eligibility approval, and then you have to send the expression of interest. You have to fill up the form in the RCOG website itself, expression of interest for appearing for MRCOG part 1 exam. Is it clear? Is
Thank
it
you.
clear for everyone?
Yes,
Yes,
I think you're
clear.
writing in the
Yes.
chat that it's clear. Abir, it's clear. Marvin, it's clear. Walaikum assalam, Marvin. Thank you very much. We are good. Thank you very much for asking, my
Yes,
dear.
ma'am.
Thank you. Thank you, my dearest. So are you all clear about that? How is the account made? What are the documents that should be ready with you guys? Yes? Okay, great. Thank you very much. All right. So, any details further, Safa, just to elaborate that for students? Abir, you're clear about this?
Yeah.
Okay, great.
So for exam, the two things to be done. One is eligibility approval, and second thing is that expression of interest for part one. You have to fill up the form. If anyone have applied eligibility before itself, then there is no need to apply this eligibility every time. But expression of interest is must for every time. Though you applied for last time, for Jan 2026, for June 2026, again you need to fill up the form. Okay.
Absolutely. So, what is the aim now? This batch, we are aiming for the exam date Thursday, 30th of June, 2026. Every time we have this exam in July, but this time we are already in the end of June. And I'm sure that we guys together, we are going to make it a success with all the hard work, step by step preparation, starting with enthusiasm. Don't forget the expression of interest closes on Tuesday, 24th of March, 2026. Part 1 eligibility deadline, as Safa has explained, Marvin, Tuesday, 10th of March, 2026. These dates are very important because, God forbid, if you miss these dates, unfortunately, the exam application would not be accepted. You're not able to go it further, right? Okay. So the fee structure varies according to the country of residence. It is basically the banding that matters. And you can see on the screen, the banding applies to the center in which you're taking the exam. It's not actually where you're living, but what is college having in the application in terms of your center, that is where the fee applicable will be there. Please see in front of you for UK and Republic of Ireland, the band A, B, and C. The fee structure for 2026, the college has already given there. How to prepare, what is the content, what is needed, how we are going to make it a success, how we are going to divide it, how we are going to reinforce, how we are going to devise with you guys. Why every student after coming from the exam says, oh my God, it seems that you guys made the exam. Oh my God, it seems that everything was from the course, because we do it step by step, making your basis very strong and then reinforcing, revising, and every single aspect is discussed. I've got Preeti here, responsible for anatomy and embryology. I've got Orva here for very important subjects. I've got Safa here, who is going to lead also along with that, doing all the important topics, pharmacology, and those topics which are scary about biochemistry. Let's take it one by one and let's see. If you have any questions from any of the topic, please ask here. But when you will be doing these sessions, you guys would come up with wonderful feedback because your bases would turn very, very strong, please. I will be taking the module number 12 in front of you, the clinical management and data interpretation. That is related to all those interpretation questions and would try to make it very easy, very simplified, and very crisp for exam. Please, Safa, go ahead.
Yes, ma'am. So about part one exam, this is a basic one. So whatever the basic subjects we have, like starting from anatomy, embryology, biology, biochemistry, physiology, which are in the first year, and then paraclinical subjects like microbiology, pharmacology, then we have immunology, pathology, and along with that we have genetics, biophysics, biostatistics, and clinic endocrinology and clinical management. Okay, these are the basic subjects, and we have different types. Like the paper one, it is mainly the anatomy, physio, biochemistry, embryology, endocrinology, genetics, and biostatistics. Sorry. Whereas in paper two, we have paraclinical subjects like pathology, pharmacology, microbiology, immunology, and data interpretation. Okay.
Yes. So this slide is very important, guys, because this slide is going to tell you that where you need to put more attention. This slide tells you that where you need to have more stress upon certain parts of the subject. And it also gives you satisfaction. All right, I've done anatomy, so 25% is done. I've done embryology, another 8% is covered. I've done physiology, 17% of the curriculum is done. So this shows to you that how directional the preparation should be, how you're going to be more focused in your preparation. The exam format, Safa.
Yeah. So exam format, actually the exam is in the Pearson Center. It's a computer based exam. Okay. And language is English. There is two papers, morning one paper one and then afternoon paper two. You will have 100 questions. It is a single best answer. Question will be there and there will be a 5 options. Among the 5 options, you have to choose only one answer. Okay. And this exam, the paper one, it is 50% of the marks, and paper two, 50% of the marks. Okay. And there is a very good thing about this exam is there is no negative marks.
This is very
Okay.
reassuring, guys, that whatever it is there, you need to attempt that because there's nothing where you need to have concern that I should miss this question or skip this question because there might be some negative marking as well. Yeah. So, Safa, they have a gap in between as well, right? They've got lunch break of 1 hour, is it?
Yes, ma'am. Yeah, it is around, timing is around 2.5 hours in the morning and 2.5 hours in the afternoon.
Yeah.
In between, 1 hour of lunch break would be there.
Yeah, so it is a lunch break, but we always say that please stay easy in that time. Pearson Center, we are going to guide you about how the Pearson Center is, how you're going to take exam on the screen, what are the reading strategies, how you have to be focused, how you're going to take it further. When you will follow up the sessions, you'll be very clear about that, how we have to make our reading skills on the screen crisp and more focused. With the passage of time, learning through the sessions, you'll get better in that. Preeti, are you
Yeah.
there? Are you able to unmute yourself?
Yeah.
Yes,
Hello.
Now we
ma'am.
will see all the subjects one by one, that what is important in each subject, and the mentor will be explaining.
Absolutely. So we have got Dr. Preeti here, and she's responsible for two very major subjects, but she is famous for her mnemonics. She's famous for reinforcement. And students, they always give me the feedback that after the session, it's like more than 90% is already absorbed. And anatomy is very volatile, friends. Embryology is very volatile, but the way it is taught, it actually is made very easy for you guys. And this is what years and years we have been listening to the feedback. Yes, Preeti, please, are you there?
Hello, ma'am. Thank you for the kind introduction. Hello, everyone.
Please go ahead. Yeah.
So, anatomy basically is one of the largest subjects. About 25% of the marks are there, and it's very scoring because anatomy it will never change. So there will never be something that you've never heard of before. So we have certain sections in anatomy. We go with the bones, pelvic bones, fetal skull, then the anterior abdominal wall, the femoral triangle, the muscles of the pelvis, and the vulva and perineum. Then we do have some of the miscellaneous topics also. We have the organ structures like the urinary tract, the uterus, and the nerves and vessels of the pelvis and the lower abdomen. So all this is covered in anatomy in two sessions. The first session and the second session, both together will cover up all your questions. I also put the past paper questions, the recent questions, whatever have come in 2026. I'm collecting those questions now for you. Also, please do attend the session, and sometimes the questions which have not come in the past, we discuss each and every part of anatomy in such a way that even the new questions are known to the students most of the time. So, with the mnemonics, the memory is created very well. You all must try and attend the session when it's live. If you can't, then hear the recording. Thereafter, embryology is immediately taken and it goes hand in hand with the anatomy because the development, when we do the urinary tract, the uterus, fallopian tubes, which also discuss the development, and that is immediately revised in the embryology. Then there's development of the cardiac system that doesn't come very often, GIT, and that doesn't come very often, but certain other aspects like development of the embryo and pharyngeal arches, they do come. The timings are important when the particular structure develops, and the ectoderm, endoderm, and the mesoderm, which structure develops from which part. So that is all covered, and we discuss lovely mnemonics, and you will have a very good memory. Another thing about the anatomy part, the nerves and vessels question, pay special attention because that comes in your part 2 exam also. And that time in the part 2 with the large syllabus, if you have done this part well, you don't have to revise it much. You will already know it with the mnemonics. So you must concentrate on these aspects. And otherwise, once it's done, it's easy to remember and with the mnemonics. And you keep revising, and you will have certainly have a good memory in the exam.
Absolutely. Thank you
Yeah.
very much, Preeti. If any questions you guys have for the anatomy or the embryology, Dr. Preeti is here, and she's going to start with the module soon with you guys. But Ehlam, Anchita, any Deepika, my dear, Shubham, if any question is there, Lisa, anything related to her subject, please. She's happy to answer. No, so you're anxiously waiting for the session. Yes, please, Safa, go ahead. Microbiology.
Yeah, okay, ma'am. So the basically we are starting with this regular course. This regular course mainly we focus on the high yield topics on every subject, because it is not humanly possible to revise everything for the exam, what is important for this part 1 exam, MRCOG part 1 exam, we focus mainly and we give you all the high yield points. Because in last exam, students felt somehow little difficult, whereas our students, our co-students felt so confident because we have taught completely from the updated guidelines. So in microbiology, we may get around 15 to 20 questions, and though the organisms, these things are the basic things won't change, but anyhow, there will be update in the investigations and update in the instance, and all these will be we will take from the recent guidelines. From the sepsis guidelines and the bash guidelines. Okay, so after attending the classes, surely you will be feeling a good grip of knowledge on microbiology, and at the same time in immunology. Immunology, mostly they will be asking basic questions on types of immunity and types of hypersensitivity reactions, autoimmune diseases, and vaccination is very very important. And there will be an update in the college website, and we are going to teach you about the vaccinations in pregnancy in the session.
Thank you.
So after the session, you will be confident to attend any of the question, any of the, even though even if it is not a past question, you can manage the questions.
Thank you very much, Safa. What about immunology?
Yeah, immunology, yes, ma'am. I already told about the high types of hypersensitive reactions and autoimmune diseases are very important in this, and the complement system and the basics of immunity, types of immunity. We will be giving you a very good grip of knowledge on immunology in the session. And the next important subject, it's not much important because in the exam hardly you will get 10 questions, but it's a very volatile subject, and there will be a questions from the metabolism and vitamins. Though vitamins, we are learning vitamins from our primary school, even though the vitamin questions are tough for the students, but we will make it clear, because if you follow any books like the essential revision guide, these are not updated. Many things are not updated in the book, but we will provide you from the updated guidelines, from the updated books. Okay, and also, very important thing in the biochemistry is about the steroid synthesis. Every time, even the last time they gave the picture question from the steroid synthesis. Okay, in the classes, we will teach you how easily you can remember, and very importantly, the acid-base imbalance, how to manage this acid-base disorders, because this is the basic thing we are learning in part one, and that will be helping you till your part three exam. Okay. Then next subject about pharmacology. Pharmacology, I'm also this subject is also will be taken by myself, and pharmacology is very important because we have so many drugs updating every time. Even now the HIV drugs are updated. Okay, so we will deal all the drugs involved in gynecology and obstetrics, and what is up in there in the updated in the RCOG guidelines, in the green top guideline and the nice guidelines. We will teach you all those updates, and you will feel confident about clearing this subject easily. Okay, and this subject is very important comparing to anatomy in the paper 1, whereas pharmacology in paper 2 you will have almost 20 to 25 questions.
Thank you very much. Thank you. We've got Urva here as well, Safa. Yeah? Urva, you joined, my dear.
Yes,
Are you
ma'am,
Yes,
I'm
there?
ma'am.
here.
Yeah. Yes.
Yes, ma'am,
Hello.
I'm
How
here.
are
So,
you?
Hi, ma'am. Hello.
Yeah, Safa,
and
go
in
ahead. And over.
yes, in pathology as well, there will be questions from the histopathological examination and about the cancers. So all these we can't believe on the old books. So we have to read the updated guidelines. In the session, we will give you whatever is important for the exam purpose. The high yield topics will be taught for you all. Okay.
Right. Thank you very much, Safa. So we've got physiology here.
So, hello everyone. So I'll be taking physiology for your everyone, and so we get around 10 to 15 questions in physiology, And physiology is very important because this will make your basis. So we'll be covering in detail about female reproductive system, the male reproductive system, as well as the fetal physiology. So fetal physiology as well as the Rh negative female, how do we deal with those patients? Everything will be taught. And physiological changes in pregnancy. That's really very important because we have many percentages in that. So by the end, you'll be very clear about how what happens to the lung capacity, what happens to the heart, and everything will be clear at the end of the session. And we'll revise all the percentages very well. So at the end, it will be very clear.
Yeah.
And
Just a
next,
minute, Dr. Urva. We have a question from the some person. Not the name is not there. It's iPhone. She's asking. I would like to know if the exam has become more detailed and precise with less repetition from the past questions. So actually, it is not about repetition. It see, for example, they will be asking you the question around. See, for example, estrogen. What is the carbon number of estrogen? It has asked in the last exam. So next time they will be asking you what is the carbon number of carbon atom in the progesterone. Okay, it is not the same question, but around that. So in the regular course, this is the purpose of the regular course where we give you the complete knowledge about the subject. Okay, so there is no need for you to read extra anything. Whatever is given, taken in the live session, it will be sufficient for you to crack the exam with more than 80%. Okay, you got it, Dr. iPhone?
All right, iPhone, we would like to know your name so that we can address your query, but I hope you have got the answer and you have understood as well. Yes, Urva, please continue for the
Yeah.
endocrinology. Thank you very much. Yes.
yes, ma'am. Thank you. So yes, again, endocrinology is a part
My
like
name
after
is Nimra.
physiology.
Nimra. Nimra.
Nimra, thank you very much, Nimra. Happy to have you here. If any
Thank
other question
you.
is there, we are happy to take it, my love. Thank you. Yes,
Okay.
Urva, what about the endocrinology?
Yes. So endocrinology, like once we finish the physiology, we go to endocrinology because it's in continuity. So after that, we'll learn in detail. Like around 10 to 15 questions, they do come from endocrinology. And then we go into detail of the placental structure, what are the functions of the placenta, and various disorders which will be there. So adrenal, thyroid gland, and pancreas, they become very important, and the related disorders, that thyroid disorders, diabetes, so everything will be clear. Adrenal, Addison's disease, you'll be getting very good mnemonics of the same. So all the disorders become easy when the Cushing's becomes easy. And what tests we do, how do we diagnose everything? So in all, and also the hypothalamic disorders, pituitary. So we'll come to know all about the MRKH and all the amenorrhea cases very well. And then we go to genetics. So genetics has 10 questions and everybody's very scared of genetics, all the pedigree charts, how to solve them. So I'm sure that at the end of the sessions, you'll be able to solve all the pedigree charts very well. Any kind of pedigree chart you get, and you will be able to do it.
So actually, I used to see, ma'am, our part one students, when they are coming for part two, they are very confident about this pedigree, chart management, and inheritance, everything.
Absolutely. When you
Am I
guys see
correct,
me for
ma'am?
the part two, and we have got maternal medicine session where I do the autosomal recessive, autosomal dominant, and when I'm doing the X-linked recessive, I'm always proud of you guys because the type of the information you're bringing from the part one that is so stronger that helps you in the extended match question in part two as well, where definitely it's more challenging. So whatever you're reading in part one, that makes your basis so strong that definitely builds up a higher and a stronger foundation for MRCT part two and eventually in part three as well. So do it with full zest and do it with full aim of the confidence gaining, and that will really help you guys for the further parts as well. So genetics, Sisafa. Done?
Yeah.
Pedigree? All right,
And
great.
biophysics.
Yes, Urva.
Yes, ma'am. And biophysics, again, there'll be very few, less 5 to 10 questions will be there. But very important electrocautery, how do you manage it? So clinically also, it's very important. How do you manage electrocautery and electrocautery machine in your basics? So that will solve all your basics. The ultrasound, how do we do the ultrasound? What are the wavelengths which are required? And what are the radiation doses? Because now that's a favorite question. Even in the last exam, they've asked about the radiation doses
Yeah.
in detail about X-ray, CT, MRI. So everything will be or taught in detail so that any kind of question which comes in the exam, you'll be able to solve it very well.
Thank you
Yeah.
very much. Thank you, my dear. So, in the end comes the data interpretation, clinical and data interpretation. I'm going to take this module for you guys, both in the regular premium session and then the recalls in the fast track as well. When it comes to clinical and data interpretation, a little tricky it is at times for the students at MRCOT Part 1 because many of you do not have too much of a gynec and obstetrics clinical based information. Many of you are very new to the obstetrics. You've not had your training. You don't have your rotation in this aspect. How the questions that come up? The questions come up in scenario based, and I teach you, for example, the semen analysis is there. How do we proceed with labeling oligozoospermia? How do we manage if it's asthenoteratozoospermia? The CTG cardiotocography, that will be overlapping with biophysics, but we tell you that how the accelerations or decelerations, or for that matter, variability or the normal CTG has to be done, interpreted, and how we have to manage the labor for that. Similarly, the acid base analysis will be done by SAFA as well, but the interpretation questions in terms of acidosis and alkalosis, I'm going to highlight there. A very important aspect of clinical and data interpretation is fetal infections. How the mum presents with chicken pox, how the baby's presentation is there, what happens to the fetus in terms of the consequences of having an infection. How do you pinpoint? Is it a chicken pox? Is it a rubella? Is it a measles? Is it a parvovirus? And what happens? The clinical scenario question comes up, and you have to pick up the specific fetal infection. We would make all the ulcers, all the sexually transmitted infection, the chicken pox, rubella, parvo, very easy. The subfertility investigation, how much serum progesterone level should be there to say that it's ovulatory patient. How should be the FSH diagnosed if it's a premature ovarian failure? How we have to specifically interpret the data, that is going to be my responsibility, and I'm going to see you in the last session when we wind up the MRCOT Part 1 premium session. Coming to the biostatics, where you're always so scared of the type of the questions, we have got a wonderful mentor. She's going to take for you the biostatics, one of the gold medalists of RCOG. And moreover, the reinforcement would be done in the study crew by the moderator as well. You will learn every single aspect of biostatics with the past questions, the study designs, the screening test, and all aspects will be solved. What is the importance of the book, Safa, and how important it is? The first question which you always get is that, ma'am, is it enough that we do the sessions, or do we need to practice as well? And which source is needed? How to do the revision? How to apply the knowledge to the single best answers? Yes, please.
Yeah. Yes, ma'am. Actually, there are some textbooks are there, and same times there are SBA books are there. We may advise you to follow the SBA books for the questions, but the textbooks or the problem with the textbooks are not updated one. So whatever is taken in the live session, if you take one-liner notes, this will be sufficient for you to pass this exam with more than 90% of the marks. Okay. So basically, we follow the essential revision guide. Ma'am, next page, please. Essential revision guidebook as the reference book always. Along with that, we have this textbook for basic sciences. That one is there. We can follow mainly the essential revision guidebook as a reference. Okay. Other books for SBA books we can do. We have a daily 1 hour discussion session will be there in the Telegram. Okay, the time will be, we will inform you around 3 p.m. GMT like that. And the mentor will be doing daily discussion 1 hour. See, for example, we have the schedule. We are starting with the anatomy. So daily discussion will be there in the Telegram, and we have a live session on Sundays. Every Sunday you have a live session on subject, but particular subject. For example, coming week we have anatomy session by Dr. Preeti. Okay, so you have to attend at least 1 hour. You no need to read more than 1 hour for this exam. Read 1 hour during the discussion session. Read and then attend the live session. During live session, I just request you all to take one-liner notes. This will be helping you to revise, because in the last minute you can't go with the videos. Okay, it is difficult to watch the videos again and again. Instead of that, while attending the live session itself, or when you listen to the recording, you just take one line and notes. Okay, so that it will be helpful. And whatever is the updated one, we always give you the updated information from the guidelines. Okay, so live session recording, listening to the live session is very important, and take notes from the live session. And in the website also we have notes, important notes on all the subjects. If you go through that as well, that will be sufficient. Along with that, we will discuss all these SBA books questions in the Telegram. Is it clear, everyone? Any doubts in this?
Did you guys understand that how the format would be? Did you guys understand that how the pattern of practicing questions, because they're equally important to do the theory, right? Yeah?
Yes.
Yes.
Thank you very much. Thank you. The problems with students they face is this exam has got a very high passing rate, but if at all somebody is not able to make it, it's just because of the examination stress, or maybe their mindset is very shaky, or they don't know the exam strategy. So what we want is that you start with the willpower, and do not forget that why we started. You have a very perfect time management generally while preparing in a very focused study technique with step-by-step sessions and a targeted approach to reach to the way of studying. Word to word revision guide, but we do not do the older aspects. Please, updated information from the sessions you have to take. Just take one liner notes. Practice exam questions multiple times and make a separate notebook for confusion type questions. You guys would see the change. Yes, Safa, what do we offer to them?
Yeah. So in this is the regular course. Okay, we have a separate faster course as well. This regular course is mainly to give you the complete knowledge of the subject. Okay, so we have all subjects. We have 15 live sessions. In anatomy, we have 2 live sessions, and pharmacology we have 2 live sessions. Apart from other subjects, we have one live session, and in statistics, live session will be separate. Okay, and we have a dedicated schedule will be there, and in the website you have important notes is there, and after every subject you will have a question module wise, subject wise question pools, and also mock exams will be there.
Absolutely. The mock exams are very important, friends, because the more you're going to self-assess yourself, the more you're going to understand that where do I stand today and where I need the improvement, please. So remember
Yeah.
that these course features are for multiple revision, multiple understanding. Before you, we had so many shining stars to an extent that we have scored 98% in MRCOT1 exam as well. So we want to tell you that this is a doable exam. But of course, we don't want that the starting is with an overconfidence. We want confidence, but we want, of course, revision. We want repetition, and we want a very focused study. You all can do that aiming now, the June 2026. You guys would see the change in your preparation with lots and lots of positive feedbacks. You would see the change in your preparation after the sessions. The only thing I would like to say is that have a very strong mindset, and ups and downs in the preparation would be there. Do not feel that I will be missing out if at all one day is missing, because at the end of the day, it's all about consistency. And it's about part one and entering into the other parts, please. We've got the live session schedule. Today we are meeting for the introduction. So Preeti is going to take the anatomy 1, anatomy 2 for embryo also. So you're going to meet Dr. Preeti in the beginning, and then Safa will take over. Similarly, for eventually for different sessions, you guys have different mentors, and the daily reinforcement would be done by the moderator. You guys would gradually feel stronger and stronger. What I want is that you do the upcoming sessions and you revise the older sessions. This is the best technique to go ahead. Yes, Safa, about the daily schedule, you would like to give some tips, please.
Yeah, yes, ma'am. So we have a daily schedule. So from tomorrow we are starting anatomy. As per the schedule, the anatomy will be going till February 3rd. Okay. So daily we have 1 hour discussion. This discussion mainly SBA questions, focused on the questions. Okay. Whereas in live session we will teach you the theory part. Daily discussion will be about the questions from the various sources like past MRCG strategy. So many books are there. Andrew, Catherine. Okay, all the questions will be covered by the moderator. we request you all attend daily 1 hour. This is sufficient right now. This 1 hour attendance is enough. So don't feel that while attending, I'm not able to answer correctly. It's okay. You learn it every day from the mentor, from the telegram, from the live session. You are learning. Okay. This is not the last part like a rapid revision where you have to know the answer. But here it is not like that. Why I'm stressing this? Because after attending 1 or 2 daily discussion sessions, students used to tell that we don't know what is this, what is it. It's okay. You have to learn every day from the telegram discussion. This is what we are expecting. You spend only 1 or 2 hours. You can take one liner notes as well. This one liner notes is very important for part 1 exam. This will be helping you during your last minute revision for your exams.
All right. Thank you very much. How you have to join for the course, the ones who are asking.
Yes, Dr. Abrar, we will inform you that the moderator will inform you that from which book we are doing this discussion. In Telegram, we have a separate Telegram group for all the study resources. Okay. In that group, we have subject wise, we have a subtopics, we have all the materials is there. Okay. You can check from that and you can read.
So the link of the MRCG1 Premium June 2026 is there. The link says it's 299 USD. However, when you put the coupon 50RFAM1, that reduces it to 149.5 for the next 1 week. You have to validate, please, and then do the checkout. It's going to give you 50% off. And the ones who have joined, please make sure that you don't miss out the live session, the daily Telegram discussion, the subject-wise mock exam, and ensure that your self-assessment after each module, after each subject is very clear where you stand, what is the plan, how you have to cover up your weaknesses. It is very important that you exactly know the content as a strong candidate and make sure that you not only aim to pass this exam, you aim to be successful in this exam with very high score that boosts your confidence for the next parts as well and makes you understand that, okay, right, I can take and clear the MRCT part 2 and part 3 in one go as well, right? Any questions, please? We are happy to take. Yes, please. Abrar, any question? Namra, any question? Shami, any
Yeah.
question? Isra?
Hi,
Yes,
ma'am.
please. Hello. Hi,
Will this
Shami.
all sessions? Good evening, ma'am.
Hello.
So, will this all the sessions will be available offline?
So what happens is that once the session gets completed, 4 to 6 hours, the backend team takes to upload it on the website, and you can listen to it as many times. However, you of course need internet for that to log into your website and listen to the sessions, and you can listen to it as many times till the exam date. Okay.
Okay, thank you, ma'am.
Thank you very much. Thank you. Where are the questions
Yes, ma'am.
available?
Actually, ma'am, here I want to tell you as well, ma'am, after the exam, last week exam,
Yeah.
so few of the students, they are not our course students, they message me, ma'am, how is the exam? How the students are telling? I told it's good exam. It's everyone. Because in our course, after in the rapid revision, students are very happy that they are able to manage even though questions are not that much familiar, like not repeat questions, not much repeat questions, because the
Yeah.
subject which we give, the whole theory, we are giving the high yield points on not only the previous questions. In the regular course we give them the basic concepts which really it helps them for the exam.
So we actually do not train you for the recalls only. We train you for all the possible questions, and that makes you very strong in those which are like new. As somebody was writing in the chat box, that the college is changing the pattern in a way that is not like 100% the past questions. So we train you in a way that whatever questions are coming up, that will be done in the Telegram. And if you make your one-liners and if you make your notes from there, you will be very confident to solve any type of questions available, right? Thank you
Yeah.
very much. Any other
And
question,
at the
please?
same time, in the open group, always we always do the daily discussion. It will be starting from tomorrow. So you have to attend that as well, because there we will be discussing the past papers. Okay. So we request you all to attend open group discussion as well without fail.
All right. Yes, the
No.
more you're going
Yeah.
to discuss, the more you're going to feel stronger. And if you're not able to do that, maybe your schedule or maybe the day doesn't, I mean, you've got some chores and commitment. So what you can do is that before sleeping, you can scan the group and just see that did I miss anything which I will be reinforcing, and that will help me. All right. Thank you very much, Abir. Thank you. Any other question, please? So tomorrow it will be the live session or it will be the SPA. The live session
It is
schedule,
discussion.
yeah, we have
On
already shared.
Sunday. On Sunday. Yeah, Dr. Uva, you want to speak something?
Yes, Urva, please, about the discussion, Urva, how you're going to take them further and how it's going to be the reinforcement, my love.
Hello.
Yes, Shubham.
Ma'am, actually wanted to ask, like a few of us haven't completed our MS program, but we have completed our MBBS, and after that we are pursuing MRCOG Part 1 exam. So will the
Understandable.
course cover the basics? Like,
So, Shubham, that's the best time because the
This
more
is
your, the more the medical schools been,
Dr. Subham, this
they
is like your part. You are having this
medical
MS
schools.
exam. In
Yeah.
MS, you have the paper one, basic science. MRCOG
yeah,
part one is same like basic science only, but it is related to the obstetrics and gynecology. They won't ask
okay,
anything beyond obs and gynac. Okay.
So,
okay,
so
ma'am.
the more closer to you are to your medical school, Shubham, the easier it is to clear MRCOG 1. And the students who are very senior obstetricians who come to me saying that we have to do the MRCOG, the only part I'm scared about making them go back to the basics because the part 2 and part 3 is more of the clinical, the more of the practice, but the part 1 is typically that basic structure which we learn in the medical school, like your physiology, your biochemistry, your pharmacology. So for the fresh candidates and the ones who have recently been through the medical school and they are not into practice for long, it's very easy, and that's the ideal time to do MRCOT part 1, honestly. Okay.
Thank you, ma'am.
Thank you very much. Thank you. That's absolutely okay, Abir, and that's amazing that if you've taken it as early as possible, and you guys would do great. You would see the change. It's a huge, huge RFA alumni starting from Singapore, Hong Kong, Malaysia, the African countries, South Africa, Kenya, you name Zimbabwe, so many alumni in all the Gulf, Oman, Qatar, Kuwait, UAE, Saudi. You'll find the bulk from India, Pakistan. You'll find so many students from NHS, UK, Ireland. You would see the difference that from different parts of the world, different students, they've got their strengths and they've got their weaknesses. It's a very, very big family, and you'll find togetherness, you'll find connectivity, you'll find that in the group, there's somebody to support you and there's somebody to hold your hands through all the three parts, and you'll find the change in your approach towards your study pattern. This is what RF is all about. Any further questions, please? We are excited to start this batch. Not only start this batch, to lead it to the success in June 2026 with lots and lots of prayers, with lots and lots of blessings, with lots and lots of hard work together. Thank you very much for joining in. If anything from our side, please let me know. There's a huge team for part 1, and they will be dealing with step by step. But if anything you want to get connected, please note down. This is the first number, which is for me. This is my WhatsApp. You can get connected. Feed me back about how things are. If you want to give any sort of a change suggestion, we are always happy to accept that. We have the backend team meeting, we have the moderators meeting, the mentors meeting. And if you have any website concern, please, this is the second number where if your access, you're not able to do that, you're not able to find out any sort of a folder in your website, you have any concern about the website or the technical aspects, please, the second WhatsApp is there. Or you can drop in a message, find me on Instagram by name of Sidrali Mentor. You can drop in a message on my Instagram for any sort of a query, any sort of a concern. In the study group, you would find so many people on your tags answering to you guys, discussing the things. And of course, the newcomers who would be joining, I would request all of you to guide them side by side, that they should not be feeling that we are starting somewhere in the middle, how to cope up with that, because the strength keeps on increasing with the passage of time. Right? Thank you very much, Moon. Thank you, Marvin. Thank you, Shami Karan. Thank you very much. Safa, the last advice for the students before we kickstart the MRCT Part 1 batch.
Part 1 is a very, very easy exam. Just need your consistent 1 hour That's it.
What a blessing, guys. If somebody is saying to you that 1 hour and part one is done, but that 1 hour should be away from distraction. It shouldn't be 1 hour like that. I tell to the part two students that everything comes in mind in that 1 hour. Oh my God, what to cook tomorrow? Oh, we have to give the pay to the maid as well. I think the diapers and the pampers are also ending. So if it's 1 hour, that 1 hour should be free from distractions. You give 1 hour to us and we give you the successful result. Please, away from distraction, away from your phone. Focus study of 1 hour for now, and you can increase it near exams 2 to 3 hours. MRCOT Part 1 would not be a problem. I know students who have started the Part 1 preparation just 1 month. I know a few who've done just in 20 days. It's a doable exam, guys, but aim should not be passing. Aim should be scoring very high to be very confident for the next parts. Right? So I need consistency. I need focused preparation. I need togetherness. I need that when I come to the study group and I see you guys, it's a family. It is supporting each other, helping each other, and listening to the mentor. If any help is needed, we would definitely be taking the responsibility and helping you guys in this journey. Thank you so much. Best of luck from the entire team of RFA tutors, with prayers, with lots of wishes. May this journey turn out to be the successful one for you guys. May every single moment of being with RFA turn out to be blessings. Remember us in prayers, and you guys are always in our prayers. Thank you very much. Best of luck. Let's make it a success together. Thank you so much, everyone. Thank you, Safa. Thank you, Orva. Thank you, Preeti.
Yeah.
And thank you
Thank you,
very much.
everyone. Thank you, ma'am. Thank you.
Best
Thank
of
you,
luck,
thank you,
everyone.
ma'am.
Thank you very much. See you guys in the study group with lots of enthusiasm and lots of passion. Thank you. Bye-bye, everybody. Thank you very much.